Now, we are going to say a few words about mitral regurgitation. This disease is a little bit complicated than the mitral stenosis. The etiology is also a difference. Except for rheumatism, effective endocarditis, rupture of chordae tendineae, dysfunction of a papillary muscle, or even mitral annulus dilatation will cause mitral regurgitation. The pathophysiology of mitral regurgitation is similar with that in mitral stenosis. You see the backflow into the left atrium causing blood pressure rise in the left atrium, and then the pulmonary congestion and the edema will present. In the other arm, the increased preload and the decreased contractility of the left ventricle will cause progressive left ventricular dilatation, and this will impair left ventricular contractile function, and heart failure may eventually occur. As for the treatment of this disorder, 15 years ago, valve replacement was the only choice. But nowadays, valve repair is the best choice for the disease. These three pictures shows how the mitral valve is being repaired. First, we place suture on the annulus, and then all these sutures are passed through the annuloplastic ring, and then the ring is parachuted down to the native annulus for durable repair. And these three video clips shows the process of a mitral repair. First one, we place suture, and then we put the suture through the annuloplastic ring. And the third chip is the final result after a water test. You see, there is no leak. This is a water test to confirm the result of a mitral repair. And now we are going to discuss the famous disease is called coronary artery atherosclerotic disease. The disease is very common now. Almost every ordinary people know something about the disease. The etiology is due to atherosclerosis. You see, atheroma is accumulated within the wall of the coronary artery, and when the plaque grows bigger and bigger, the lumen becomes narrower. Due to the narrowing of the coronary artery, the blood supply to the myocardium is decreased. So the pathophysiology of the coronary artery disease is simple and easy to understand. You see, the blood supply to the myocardium is decreased due to lumen narrowing. There are two situations. The first one is a partial occlusion. At this time, patient may remain stable, but at the time of increased oxygen demand, for example, emotional or exertional, patient may have a myocardial ischemia. And clinically, it is called angina pectoris. And the other arm shows the total occlusion. If it is acute, then myocardial infarction will occur. The consequences will be cardiogenic shock, sudden death, rupture of a papillary muscle, which will in turn cause mitral regurgitation, and even ventricular wall aneurysm formation. There are three main treatments for the coronary artery disease. That is medical therapy, or PCI, called percutaneous coronary intervention, or CABG, that is coronary artery bypass grafting. The big green arrow shows the sequence of the treatment. But remember, the three treatments are closely correlated. And this drawing shows the treatment of coronary artery disease. The left one shows the PCI. That means the stenotic coronary artery is dilated first with a balloon, and then a stent is inserted into the coronary artery to stabilize the dilatation of a coronary artery. As for coronary artery graft grafting, it's easy to understand. A blocked artery is bypassed with a vessel taken from the human body, and this allows the blood flow freely to the distal myocardium. And these two video shows the operative view of a CABG operation. You can see the heart beating. So it is called off-pump coronary bypass grafting without the use of a CPB. Now the coronary artery is being cut open. And the later video chip shows the graft is being anastomosed to the native coronary artery. Now we are going to discuss the last disease. Is called chronic constrictive pericarditis. Definition: chronic constrictive pericarditis is a chronic inflammatory process that involves both fibrous and serous layers of the pericardium, and that leads to the pericardium thickening and the constriction of the ventricle. The resultant impairment in diastolic filling reduces cardiac function. Etiology is very complicated. A wide range of disease will cause the constriction of pericardium. But nowadays, the infectious etiologies, particularly tuberculosis, are common in China. The pathophysiology of constrictive pericarditis is simple to understand. You see, due to prolonged contraction of the myocardium by the constrictive pericardium, the ventricular dispensability will occur. Dispensability means the ventricle cannot expand freely. So the venous blood cannot go back to the heart. So the venous pressure will be increased. Symptoms like hepatomegaly, ascites, pleural effusion, angioedema is very common in this kind of patient. And also, the constriction of the pericardium will cause myocardial atrophy, just like disused atrophy. This will impair heart function, and the decreased cardiac output will be present. The patient will easily get the feeling of fatigue. And this chest film shows the calcification in the patient of constrictive pericarditis. In fact, the line of calcification is the golden standard for diagnosis of the disease. And this CT scan shows a massive calcification of the pericardium. You will see it was difficult to remove this calcified pericardium. In the left video chip, you see the calcified pericardium is very thick. The heartbeat could hardly be seen. So the pericardium is so thick, seizure did not work. So I have to use a longer forceps to bite the calcified pericardium piece by piece. The operation was very time-consuming. You see, at this time, the forceps seizures does not work well. And the right video chip shows the end of the operation. You can see the heart regain its beat vigorously again. Cardiovascular diseases are among major threats to human health. Thanks to the advances in technology, many acquired disorders in cardiac surgery can be treated surgically with good results, with operation mortality rate about 2 to 3%. There have been also changes in cardiac surgical demographics with increasing interest in percutaneous intervention and vascular graft technology. With the new advances, more modifications are expected. This is the end of this introduction on cardiac surgery. Thank you very much for your attention.